Hello everyone and welcome back to my YouTube channel. So today's video is about the general information of basic diseases and the medication with brands that is given for those diseases. Many a times, there are certain small symptoms or small, we can say, uh, when we do not feel well, when we are a little unwell, but we can do some self medication like homemade remedies of using turmeric, tulsi, neem, etc. Similarly, there are certain OTC medications that, but yes, of course, self medication is not at all advisable. But in some cases, you can, of course, go for self medication. So, in today's video, we'll have a general overview on the medicines that are available for those few normal minor diseases. So there are few of the compartments in the hospitals whenever we go to see in a hospital pharmacy, wherein there have been separate designated spaces for syrups, tablets, capsules, pills, granules, ointments, creams, gels. So these are all kept separately. Syrups in one compartment, tablets in one, ointments in another, powders in another, suppositories, enemas, pessaries, bogies. These are rectal, vaginal, urethral routes of administration. TPN, total parenteral nutrition. Certain medications require a very low condition of climate condition like 2 to 8 degrees, so they're mostly anti-cancer drugs are stored in cold storage, and monoclonal antibodies. LASA, look alike and sound alike. There are certain medications that are looking alike and they sound also alike, like folvite, folitrexate, digoxin, digitoxin. So it is very difficult to differentiate. So they are kept in a different designated space. Folvite consists folic acid, but folitrax consists of methotrexate. They both are antagonistic effect of each other. So one can imagine if the wrong medication is given, what could be the consequences. Then there are certain HRM, high risk medications that are kept separately. Certain H1 medication on which NRX is written. Then there are surgical equipments kept in another place. The FMR, the fast moving rack, the fast moving track, where certain drugs like Ceftum, paracetamol, Dolo, furosemide, they are kept, that is Lasix injection, MSET, ondansetron. These are certain fast moving drugs that are usually prescribed. And then there are bulk drugs and bulk substances that are kept in if there is abundance. So these are the few general medications that are prescribed for fever: Calpol, Dolo 650 and Crocin. You can see the images. Calpol is available in two strengths, 500 mg, 650 mg also. The adult dose is 650 mg. So it is prescribed that the adult dose is prescribed for 650 and the children dose, the pediatric dose is around 125 or 500 mg. This is Crocin Advance. These are fast release tablets and they have an effect in 5 minutes. You can see the packaging. These you might have even consumed. They might be available at each and every house as well. Dolo 650. Next is the medicines for cough. There are certain cough syrups, certain lozenges that are available for cough. Grilling this is Grilling BroZX, this is the BroZX image. Rapitus, this is Rapitus. Cherry cough, this is the cherry cough. Benadryl, Benadryl is majorly for dry as well as wet cough. So you just have to see which cough are you suffering from. Next is the Honitus, the cough remedy. This is the Ayurvedic formulation that is by Dabur. Alex has syrups as well as lozenges. It consists of dextromethorphan, which is the main API, and it is available in the form of lozenges as well. Then there is Haldi cough. This is the Haldi cough that has tulsi and adulsa leaves. So this is also very good Ayurvedic formulation for cough. Next is the medications related to menstrual cycle. So Meftal Spas, this is the most and the widely used medicine for menstrual cramps. Mefenamic acid is present inside this, which is an analgesic. And then there is Care, which is the pure Ayurvedic herbal formulation by Himalaya. And then there is Menopause, which is ISO certified. And it consists of, again, isoflavones, and these act as antioxidants. Next is the medication related to cold, allergies, etc. So Allegra, this is one of the most commonly used medication. It is available in different strengths: Allegra, Allegra M, Allegra 30, Allegra 120, Allegra 180 mg. But the packaging is usually this kind of red with Allegra written in white. D-Cold Total. D-Cold Total is the most commonly used tablets. Levomac. Levomac is levofloxacin, which is used for throat infection majorly. It is because it is a fluoroquinolone. So Levomac is under throat infection. Monter LC, Montec. These are few. Monter LC. It consists of Montelukast, and Zafirlukast is also present, but in Monter LC there is Montelukast. In Montec there is again Montelukast. They are all leukotriene antagonists. Then there is cetirizine, in which cetirizine and levocetirizine is present, which is again antihistaminic drugs. Just remember that in allergy or cold, cough, you are majorly prescribed certain drugs like inflammatory mediators, antagonists, or certain medications that are antihistaminics. Vozet is again a medication that is levocetirizine. Next, we have medication which is for some miscellaneous uses like Pudin Hara. This is Pudin Hara, and you can find Pudin Hara in almost different flavors as well, mint and all. But Pudin Hara tablets, capsules are very widely used for stomach ailments majorly. Next, we have Volini spray, Move, Relief spray. If there is spasm, if there is contraction, or if there is pain, or if there is any problem in joints, or it is a home care medication, you can say. These are like sprays and creams that are available online. Next we have Axe brand, Pain Go, Kesari Malam, Tharasana Tel. These three are few of the Ayurvedic formulation. And Pain Go is majorly used for inflammation in the muscles, in the joints. And Pain Go is again a widely used formulation. The Axe brand is a medicated oil. It's basically special type of oil that is helps us in treating headaches. So Axe brand, one can just apply it on the forehead, or one can just take the aromatherapy, take the smell of the oil. That will also be beneficial. Next we have again is some miscellaneous common home items like Eno. Eno is available in the form of effervescence, majorly in acidity. Tiger balm again for pain. Next we have Jivan mixture. Jivan mixture is again for stomach health, for bowel health. Duk dabav lev. It's like a plaster. It's like it acts like a plaster. You just need to apply a tape over it and then allow it on the wound for some hours. Iodex again very common. Vapor up Vicks for headache, cold, cough. You can smell it. You can apply on the body as well. Cough, these are cough. This is majorly used in cough. Then there is Zandu balm again for pain in the joints, muscles. For skin care and moisturization, again we have some few medications like lactocalamine, Caladril. They both are majorly used for allergic conditions. They consist of calamine as the API, that is soothing emollient of the skin. Then we have Zarina, we have Aquasoft, Medfoam. This is a face wash. Medfoam is a face wash. It is very useful medicated face wash. Then we have Sunban. Again, it has SPF factor 50. So that is sun protection factor. Cozy Glow. Cozy Glow is basically a skin whitening gel. It is like it just removes the tan from your skin. It consists of kojic acid. So Cozy Glow gel is again very widely used formulation. Next, we have certain medications for acidity. Majorly, we have Pantocid, Pantacid, Pan-D, Pan-40. Pan-DSR stands for domperidone sustained release. So it consists of pantoprazole as well as domperidone. Domperidone is basically an anti-emetic agent, and pantoprazole is a proton pump inhibitor. So a combination is used so that the acidity is relieved even faster. Esol 40, which is consists of S-omeprazole, which is a S enantiomer of omeprazole. And next we have Omez. Omez again is used for acidity and consists of just omeprazole. But Esol is more effective than Omez. Then Rantac. These are available in different strengths, 40 mg, 20 mg, 80 mg as well. Next, we have again few household alcohol swabs. These people are not aware about alcohol swabs much, but they are to be applied on the skin, on the wound, so that your skin gets healed very quickly. And before directly applying any medication, it's better we wash it with with isopropyl alcohol or any ethyl alcohol for a better therapeutic purpose. Next, we have neosporin powder. This is most orthodox and the most common and old medication, which is used for quick wound healing, which aids in primary wound healing basically. Soframycin cream, it consists of framicetine, which is an antibiotic. It is a very widely used cream. Then we have tobramycin as well, but soframycin is commonly found in all the homes. Next, we have dusting powder, which is Zocon dusting powder. Zocon has a wide variety of antifungal agents, the tablets, the dusting powders, the creams. Zocon has clotrimazole as an antifungal agent. So that is a imidazole antifungal agent. So these are few medications. Next, we have medicines for vitamins. Vitamin deficiency is very common in today's time because there is vitamin D, E, A, B, C, K. There are different kind of vitamins available, but usually we have deficiency of these vitamins. So Bicosyl's capsule, which is a vitamin B complex. Then we have Zincovid, which is again a vitamin complex, multivitamin, multimineral. Then we have Neurobion Forte, which is again a B complex. Basically, thiamine, riboflavin, pantheonic acid, pyridoxine, cyanocobalamin. These are the few vitamins that are present, and along with them, certain trace elements and minerals are also present. Next, we have Limsi. This is a chewable tablets. Limsi. This was more popular during COVID. Next, we have A to Z. This is a syrup, and it's also the tablets are available. Then we have Avion. These are capsules. These are soft gelatin capsules, vitamin E, and USP stands for United States Pharmacopoeia. So the strength is according to the USP, that is 400 mg. And Supradine, again, these are the most common packaging one would have found. Next is Antacids, again useful during acidity and acid reflux, during gastroesophageal reflux disease, etc. Mucane syrup, Digene, and Gelusil. Gelusil is a pink. Digene is available in again 2-3 flavors. Mint is the most widely used one, and the mucane syrup as well. Next, we have general antibiotics that are given or prescribed for throat infection. Azi 500, the 500 mg is the strength, and Azi consists of azithromycin. So azithromycin is a macrolide antibiotic. Azithral, again an antimicrobial agent, antibiotic agent, that is a macrolide. Augmentin. Augmentin is a combination of a beta lactamase inhibitor and a penicillin. Basically, there are 2-3 different kinds of combinations and permutations that are widely used. One is Tezact, which is a combination of piperacillin and tazobactam. One is Sulbac, which is a combination of sulbactam and ampicillin. And the last one and the most commonly used is the Augmentin, which is a combination of amoxicillin and clavulanic acid. So these are the widely beneficial ones, and it is available in different strengths like 325, 675, 825 also. Cifran and Claribid, again they are widely used antibiotics. The Claribid consists of clarithromycin, which is another type of a macrolide antibiotic only. Cifran is available in 500 and 750 strengths as well. These are some of the ear drops and eye drops. So many a times our eyes are not moist, our ears, there is amount of wax generated, there is need of cleansing. So betnasol ear drops, candid ear drops, which has cotrimazole and lignocaine, which is a local anesthetic. Ciplox, which consists of ciprofloxacin, that is a fluoroquinolone antibiotic. Solivax, which is used to soften your wax so that it softens and just comes out. It's not deposited much. Some amount of wax is necessary for your ear so that there's no excessive pressure. However, excess amount of wax is dangerous. So Solivax is useful. It consists of benzocaine, which is a local anesthetic, turpentine oil, and chlorbutanol. Eye drops basically consist of refreshed tears. Lubrimed is widely used because it has polymer of CMC, that is carboxymethyl cellulose. And again SCMC, these are eardrops. Lubrimed and Vapors consist of SCMC, sodium carboxymethyl cellulose. These are also lubricating eye drops. Next, we have few nasal drops and nasal roots administration. These are Otrivin, the most widely used decongestant agents. We have of Vicks also. We have Otrivin, but it consists of oxymetazoline. There are certain new agents like xylometazoline, nafazoline also available. Asthalin, Furamist, Furacort, Budecort. So these are natural sprays, inhalers, nebulizers, rotacaps that are available. So one who has asthma or any severe problem, they might be prescribed one of these formulations. Asthalin is available in the form of respules. So this is again a widely used medication. Next is diabetes. There are, depending upon the stage your medication will be prescribed. There are different classes for diabetes like metformin, glimepiride, chlorpropamide, sitagliptin, dapagliflozin. Then there is tolbutamide, acarbose, voglibose. There are different antibiotic drugs and API. So these are few of the widely used anti-diabetic agents that are oral hypoglycemic. You can consume them orally, or not like insulin that needs to be administered via subcutaneous route. Metformin, it is present in glycomate, sustained release tablets, and the IP, that is Indian Pharmacopoeia strength 500 mg. Tenegliptin, there are whenever you hear the word gliptins, you must know that it is a DPP4 inhibitors. So DPP4 are basically useful in increasing the levels of insulin and decreasing the levels of glucose. So these are DPP4 inhibitors: tenegliptin, saxagliptin, vildagliptin. Janumet, again Janumet is commonly given diabetes agent, and glucagon. Besides these, there are many multiple medications for your diabetes. Anthelmintics, these are basically agents that are used for worms. So we have seen that the kids are basically prescribed Bendex, Zental or ABD. That consists of albendazole as the API, mebendazole, albendazole, thiabendazole. These are different formulations for anthelmintic purpose. Next, we have general medications for constipation. So constipation is a proper condition wherein the person is not able to pass the stools. So these are few of the agents that help in either softening of the stools so that they come out very easily, or they act as lubricating agents, or they act as bulk forming agent, that is isabgol. It increases the bulk, while liquid paraffin is an emollient, it softens the stools. Some act as a stimulant they are agents that are used for constipation, like we can say Dulcoflex, which consists of bisacodyl. Bisacodyl is also present in Dufalex. And then there is cremafin, which is most widely used. It is available in different forms, and the packaging is of green color, yellow color, pink color. So cremafin, cremafin plus, kayam churan, this is a digestive aid and widely used agent, ayurvedic preparation. Loose, which consists of lactulose. Lactulose is also a agent used in constipation treatment. Next, we have medication for ulcer. So many a times we face mouth blisters, mouth ulcers. So these Oracep gel, it is a topically used application, and then there is Dolo gel. These are two medications that consist of salicylates and lignocaine or tannic acid. So these are agents used in ulcer. Next, we have Folwite, which is used in, again it consists of folic acid, that is vitamin B9. So it is also used in ulcer. Sucrafil, which is used in peptic ulcer, it consists of sucralfate. And again, there is spar acid, which consists of sucralfate. It is available in the form of a suspension. So you need to shake it before use. Next, we have few agents for maternal and fetal care. So whenever there is a pregnant woman, or a woman who has just conceived, or a woman who has just delivered a baby. So these are the few of the powders and few of the preparations, protein preparations that are given to them as well as the child for the better health care, like Pediasure, Ensure, B protein, Lactogen, Aptamil, Isomil, Enfalmil, Neosure. Neosure is more special because it is used in premature pregnancy. So if a baby is delivered in the 7th month or in the 8th month, Neosure is a highly prescribed medication. Then there are certain medications for emesis, that is vomiting. So Vomistop, which consists of domperidone, Emesset 4 and 8 mg, ondansetron, which is the serotonin antagonist. Then there is Zofran, which consists of ondansetron hydrochloride. For kids, especially for pediatrics, Domstal, which consists of domperidone again. And then there is injectables, which is used in extreme cases, that is Perinom, which consists of metaclopramide that acts as a prokinetic agent. Next, we have certain medications for diarrhea. So diarrhea is a condition wherein there is continuous passage of stools, watery stools. So we need to stop that. So basically we give anti-secretories and certain antispasmodic agents. So loperamide, Lomofen is a commonly used medication. Ridol is a commonly used. Enerzil and ORS are rehydration salts. Their formula is approved by World Health Organization. Then again, we have Lupidium, we have O2, which is, it is a dangerous medication, O2. So you better ask your doctor because one might face extreme stomach pain, extreme vomiting, headache, appetite loss, that is anorexia, because it is a combination of ofloxacin and ornidazole. Ofloxacin is an antibiotic and ornidazole is a basically and it is a agent that is used to treat the bacteria. There are different kinds of dazoles, that is metronidazole, tinidazole, ornidazole, satranidazole. Next we have enterogermina, which is again consists of probiotic. It is a use for bowel health. Next we have biquinol. This is the image of biquinols. This is a very widely used medication. And the last is the Lomotil. Lomotil is also used as in diarrhea. Next, we have few medications for skin allergy and infections. Thrombophob, that is Zydus fortisa, is widely used. Next, we have povidone, povinaz, that consists of iodine, that is an ingredient of betadine as well. Candid cream, candid powder, which is consisting of clotrimazole and beclomethasone. Cetaphil, which has a moisturizing lotion. Vocadine, which consists again of povidone iodine complex. Zolef, which consists of miconazole antifungal agent. Fudic, which is again an antifungal agent, fusidic acid. Siloder is also widely used. Flucot and Flutivate are also used. Next, we have medications for intimate care, shampoos, and other miscellaneous purpose. V-Wash is for intimate hygiene. Sebo Wash, Triflu, conditioners, shampoos. Etarix. This is a medicine by Dr. Reddy's, hydroxyzin, which is an antihistaminic agent. So during allergic conditions, rhinitis, conjunctivitis, Etarix 25 mg, 50 mg is usually seen. Sinarest, which is a combination of chlorpheniramine, antihistaminic agent, and paracetamol, which is used as analgesic, antipyretic, painkiller. So this spondylon is basically used in the extreme pains. In the these are capsules that are soft gelatin. So soft gel is used in certain conditions wherein there is many a times we say a statement yaar gardan akad gayi or something like that. So spondylon helps in releasing the spasm. KZ lotion, which is a ketoconazole lotion, which is an antifungal agent. Also one preparation called minoxidil. It is used for increasing your hair growth. I'll write the name down here, minoxidil. So if anybody is facing some hair loss or anything like that, besides this, there are certain Ayurvedic preparations as well, Ayurvedic shampoos, creams, conditioners for your scalp care. Minoxidil. This is the agent that the main ingredient that is used for increasing hair growth. Next we have is certain agents for increasing memory. So it consists of nerve flux. There's shank pushpi as well, we'll see ahead. Mnemonics, tonorex, mind care, brahmi, and this is a very important medication, piracetam, nootropic. Piracetam nootropic is widely used for cognition, that is memory, and this is a allopathic agent, while others are Ayurvedic. They help in reducing the pain on the nerves, and they just help to relieve certain conditions of stress, distress, etc. Next we have is hematinic. So in anemic condition, there is a blood loss, or there is hemorrhage, or if there is decrease in the iron content or the oxygen content is not suffice. So certain agents like Dexorange, this is the most widely used preparation, Dexorange, and different other medications for like tonoferon, they have been prescribed for hematinic agents. You can see the other images as well on the screen. Next, we have urine infection, the medications for urine infection. That is furoped, which consists of furosemide, a loop diuretic, Renalca, a natural medication by Himalaya, cetal syrup, which is for better urination, that is disodium hydrogen citrate, the main API, and sheetal syrup again. Next, we have certain medications that are prescribed for bones. One major important note: after taking this medication, it is necessary to walk. It is necessary to walk. Why so? Because calcium deposits quickly. These basically bones are degenerated after menopause in females, because the amount of estrogen decreases and the calcium level is imbalanced. And in males also, many a times there is reduction in the calcium. So your bone health is not maintained. So we prescribe certain granules that consist of D3, vitamin D3, that is calcitriol. Cholecalciferol 6001 international unit and 1 lakh international unit. It is available in different strengths. Basically 60,000 and 1 lakh international units are widely used. Shelcal is tablets. Calcimax is a syrup. It consists of Calcimax and Calcimax P. Calcimax P consists of phosphorus. Calcimax lacks the phosphorus. And this is widely used Uprise D3 capsule for vitamin D deficiency. Next, we have medications for vertigo. Shankpushpi is for memory as well. Guduchi, this is a natural Baidyanath preparation that improves your immunity. It consists of giloy, and allopathic medication, Vertin, which consists of beta histine. So this is again widely used preparation for a vertigo condition. Next, we have agents for appetite stimulants and digestion. So many a times we say कि भूख नहीं लग रही है, or like you feel like there's a loss of appetite, there's anorexia. Doctor might say that you are suffering from anorexia. So Activate, this is a syrup that is usually prescribed, and Aristozyme, which is a mixture of digestive enzymes, pepsin and all. So diastase, pepsins, decadiastase, these are few of the preparations for appetite stimulation that that are anti-satiatory, so you don't have a feeling of fullness after having that. Next, we have gargles and mouthwashes. Here, betadine gargles, these have green colors, and remember betadine solutions have blue covers. So just see to it that there's a distinction between gargles and solutions. Gargles have green color, solutions have blue color. Chlorohexidine mouthwash and gargle, and Colora mouthwash and gargle. These are for oral care and oral hygiene. Next, we have certain H1 medication. These medication consist written as NRX. Always remember that if it's NRX, it is dangerous to take it without medical supervision. So always consult your doctor. Ultraset, which is consists of tramadol. Restil, which consists of alprazolam. Alprazolam is basically a benzodiazepine, which is a sedative hypnotic, and it's just 0.5 mg, but still it is a H1 medication because alprazolam is used for sleep, and if one has an overdose, it is really there is an antidote flumazenil for the same, but still it is harmful. Next we have Ziffi that consists of cefixime. Next we have Combutol, Ricin and Ricinex, which are anti-tubercular drugs. So anti-tubercular drugs, there is DOTT therapy, directly observed therapy, DOT. So this therapy consists of a combination of drugs so that there is decrease in resistance, increase in therapeutic activity, and better action and better faster healing. So there are different drugs like isoniazid, pyrazinamide, rifampicin, streptomycin, and ethambutol. It has a short form of PRISE, PRISE, or you can also tell it, give a short form of RIPES, a mango ripes, RIPS. R stands for rifampicin, I stands for isoniazid, P stands for pyrazinamide, E stands for ethambutol, S stands for streptomycin. Streptomycin is the only aminoglycoside that is given as a first line agent. So these are few of the medications that are under H1. Next, we have certain agents for erectile dysfunction, where the impotency. There are certain conditions that are used for enhancing sexuality, for enhancing the duration. But this is a very big misconception. So tadalafil and sildenafil, they are to be taken with very care. The Palmosil and Megalis are the brand names of the same. Usually the dose is of 12 mg or 25 mg. So it is also available in the form of Viagra. So you can just not take this medication without a proper consultation. You need to ask for a consultation and then consume these medications. And at the end, we have few medications for your heart. So blood pressure, arrhythmia, heart failure, angina pectoris. There are certain agents like Storvas, Tenlodip, Telma, Roseday, Rosuvas, Ecosprin, Pause, that are used. Pause consists of tranexamic acid, which is an anticoagulant. Ecosprin Gold is majorly used in heart attack because it consists of aspirin, which is GR, that is gastro-resistant. Aster 40 consists of atorvastatin. Storvas consists of atorvastatin, which is an anti-hyperlipidemic if there is excess of lipid deposited. Next, we have amlodip that consists of a calcium channel blocker, CCB, amlodipine. Next, we have roseday, which consists of rosuvastatin. And next, we have telma, that is used for blood pressure, which consists of telmisartan. There are different sartans available. These are basically angiotensin receptor blocker, ARB. They consist of telmisartan, losartan, valsartan, candesartan. All the sartans are useful in blood pressure treatment. And all the, you can say all the sartans are for blood pressure treatments, and all the statins are for lipidemia. That is lovastatin, simvastatin, parvastatin, atorvastatin. So that's all for today's video. I hope you have enjoyed and gained a lot of knowledge. So these are the most commonly used household medications, and these are medications that we often consume, but we don't know the uses many a times, or many a times we don't know the other alternative for the same. So this video would give you an idea for an alternative or different other medications. Again, I would like to say, do not use the term self-medication for high major disorders. For cough or for cold, you can just try few medications at home, that is fine. These are few of the medications that we saw today. Thank you so much for watching the video.